Yesterday, from the Oval Office, Trump delivered a description of the great healthcare plan. That's the name of it. Sort of on the nose, isn't it? But anyway, that's what it's called. That's what he says. And the top line is, money goes directly to you. You buy your own coverage. Big insurers lose, and you win, which is why it's the great healthcare plan.
Today, I'm thrilled to announce my plan to lower healthcare prices for all Americans and truly make healthcare affordable again. We're doing things that nobody's ever been able to do. We're calling it the Great Healthcare Plan. Instead of putting the needs of big corporations and special interests first, our plan finally puts you first and puts more money in your pocket. The government is going to pay the money directly to you. It goes to you. And then you take the money and buy your own health care. Nobody's ever heard of that before, and that's the way it is.
I like the broad strokes of that. I mean, philosophically, but of course, the details matter. For more on this and what the potential impact or what Trump unveiled to be enacted would be, C. Stephen Tucker joins us. He is the founder of HealthInsuranceMentors.com. CS, thanks for being with us. Appreciate it.
Morning, Dan.
So, it's, again, generally speaking, he's talking about reinstituting market principles into the health insurance market in this country, which I'm a strong proponent of. But in terms of what the details are here, how this exactly would work and how rough the transition from the Obamacare scheme would be, what say you?
Well, you used the word philosophically, right? And that largely is what this is. This is more rhetoric to get us through the midterms, right? And the president's been doing this for quite some time. He's going to do this all the way up till November. In reality, what he wants done has to get through the U.S. Senate. And in order to get through U.S. Senate, you have to get rid of what Republicans call the zombie filibuster. If we remember the Strom Thurmond days where he talked for 24 hours in the Senate to oppose legislation, you don't have to do that. You haven't had to do that since the 1970s and the 1980s. All that one senator has to do is object. And then that forces the 60-vote threshold. That is why the continuance of the enhanced subsidies under Biden's Inflation Reduction Act, which were scheduled to end on December 31st and did indeed end. That is why the extension of those subsidies did not occur. That is why premiums have gone up through the roof, especially on silver level plans. One thing he wants to do is reenact CSR subsidies. CSR subsidies ended in 2016. CSR is an acronym that stands for Cost Sharing Reduction. And it's available to people who are just above 138% of the federal poverty level. So that's $21,600 a year for a single taxpayer, up to about 318% of the federal poverty level. So people in that column of the federal poverty level chart can purchase silver level plans. And silver level plans are what actuarial value is based upon. And it gauges how much of a subsidy that insurance companies get from the federal government. So everything is about silver plans. Since they did not enhance the subsidies, continue the enhanced subsidies, and because CSR subsidies specifically for silver level plans ended in 2016 and have not been extended since, the cost of silver plans in states like Illinois and Washington and other states has gone up double and triple for 2026. I'm not exaggerating when I say double and triple the premium. And so what the states like Illinois did was they knew ahead of time that the enhanced subsidies under the Inflation Reduction Act due to end under Biden's law on December 31st were not going to be renewed. So they simply did what's called silver loading, making the cost of silver level plans, which people on the low end of the income scale benefit greatly from, because if you are in that income bracket, your deductible drops from $8,600 a year, as it is on the bronze level plans, down to zero, Dan. Zero deductible, nothing on a silver level plan. Yes. So
So,
Silver
but
level
but this
plans
is
are
wait,
affordable.
just so I'm following along, right? So that is for those in that 138% to 318% of poverty level. So 21 to
Correct.
70 grand or something like that.
Roughly, yeah, for a single tax filer, yeah. So those people benefited greatly up until 2026 by buying silver level plans because, and again, it's designed to help those people. Those people don't have the money to cut a check for $8,600 before the plan pays anything,
Right.
right? So it helped zero out those deductibles, and it was a part of the law that worked up until 2016, and then Congress stopped funding CSRs, right? So this year, once they knew that the enhanced subsidies under Biden's Inflation Reduction Act and on December 31st, the state of Illinois did what's called silver loading, making the cost of silver plans double or triple what they were in 2025. So that disenfranchised a lot of those low-income people because now they can't keep their silver level plan because it's double or triple what it was in 2025.
And the doubling
So
or tripling, was occurred. Why?
because of silver loading, because the federal government is not funding CSR subsidies any longer, and they stopped doing it in 2016. And so what the state did is it, for the first time in 15 years, a gold level plan. This seems counterintuitive to people who understand metal values, bronze, silver, gold, right? Gold plans now are dramatically less expensive than silver plans for the first time in 15 years.
Yeah, but
Gold plans are
why
now
now? Why now for the silver loading you're describing? Why now?
because the silver subsidies are not continuing. They have not been funded since 2016.
I know, but
enhanced
they haven't been funded for a decade. So why now?
Well, now it's because of the enhanced subsidies under the Inflation Reduction Act. They ended on 12/31. Those enhanced subsidies made the silver plans appear as though they were just as affordable as when the federal government was funding them up until 2016, the CSR subsidies specifically. So now, for the first time in 15 years, you can buy a gold plan today, which is less than half the cost of a silver plan, which is just bizarre. But it's the way the silver loading scheme works in states like Illinois and Washington. So what the president is seeking to do, and again, this is all rhetoric to get us through the midterms. It takes 60 votes to pass any of this, which means it's not going to happen. Just as a repeal and replace of Obamacare is not going to happen. Just as subsidies that are available for people under 400% of the federal poverty level are not going to end because it takes 60 votes to make these things happen. And the 60-vote threshold is nearly impossible to pass. In fact, the last time major healthcare legislation was passed with 60 votes, I bet you can guess what law that was.
Mm-hmm. Obamacare.
It was Obamacare.
Yeah.
Yes, sir. Yes, sir. So how hard is it to pass this stuff? Nearly impossible. So what are we going to continue doing? We're going to continue making promises, calling them great, crossing our fingers, and encouraging Congress to pass them. That's never going to happen.
Well, that's literally what he says: is pass it now, GOP, immediate relief for the American people we love. But
right.
yes, but do we have? Do you have a handle on any specifics that are available and how those and the mechanics?
Yeah.
Because here's what he touts at the top line, and then you fill in the blanks. End kickbacks to brokers, which reduces costs. Lock in drug discounts. That's the Trump RX, right? Forced transparency. Publish claims versus profit breakdowns, I guess, for insurance companies. And then hospitals, insurers on Medicare, Medicaid, that serve Medicare, Medicaid patients, I presume, must post all prices prominently. That alone would be really interesting to see what that looks like. But I mean, so in those sort of four buckets, the four points of his great healthcare plan, what do we have in terms of the specifics of how this would potentially work in practice if you could get to 60 in the Senate?
Well, they're already doing a lot of the things he wants to do, right? He did a lot of it by executive orders. When Dr. Oz took over CMS, which was a bizarre appointment, but it happened, in the investigation they did, much of it through Doge, they found out that there were brokers, dishonest brokers, that were enrolling people, many of them on Medicaid, who didn't need private health insurance. They were using their data Social Security numbers, et cetera, to enroll them in what's called bronze level plans, the lowest price bronze level plans. And because their income was so low, right, they enter their income just above 138% of the federal populace, so they get the maximum advance premium tax credit, which made bronze level plans zero premium, no cost for that bronze level plan. And so what happened was the brokers would get the commissions for those bronze level plans. The people on Medicaid who didn't need private health insurance never even knew they had these policies, but the brokers got the commissions. This happened at an unbelievably egregious level, right? And to his credit, Dr. Oz found that largely through the efforts of DOGE. And so President Trump is going to get rid of that. And he can do that because it's fraud. He doesn't need Congress to do that, right? The other thing he wants to do, he already started in his first term, and that was to expand the availability in states that do not outlaw them, like Illinois, of consumers to purchase non-ACA qualified health insurance, known as short-term health insurance. Instead of it lasting for only 3 months, it's now going to last for 3 years. But again, it's already happening. It happened in 2016. It stopped under Biden, and it's back without any of this great health care plan passing the Senate. It's already occurring. What the president is trying to do is codify what he has done via executive order into law, and he's asking Congress to do that. The 60-vote threshold is nearly impossible to meet in the U.S. Senate, which is why none of this is going to come to fruition via law, but he will continue doing it via executive order. And I applaud that. I think it's great to have an account where you can use money to buy health insurance, specifically a health savings account. That's a great idea. Health savings account is tax-free money. But
Right.
to do that, you have to change IRS code. IRS code specifically, by letter of law, prohibits using HSA dollars to pay for health insurance premiums unless they're long-term care insurance premiums or Medicare supplement premiums. So how do you change IRS code? You need Congress, right? So that's what he's asking them to do, is codify many of the things he's already done. To get to 60 votes is a nearly impossible threshold, as both you and I know. So more of this rhetoric will continue to hopefully get us through the midterms. But that's what it's about. It's largely rhetoric.
Wall Street Journal opined on the supposed attrition that would occur among the covered with the end of subsidies as of December 31st, and it turned out to be wildly overstated. The Urban Institute projected Obamacare subsidized enrollment would drop by 7.5 million. In point of fact, it is down 1.4 million. And in some states have extended their open enrollment through the end of this month, so we don't even have final numbers yet. So the panic over the amount of the number of uninsured who choose to be uninsured, couldn't afford the subsidies, couldn't afford the health insurance without the enhanced subsidies that we're discussing, turned out to be wildly overstated. But despite that, you're saying that you're going to see an extension of these subsidies anyway.
No, I do not think the enhanced subsidies under Biden's Inflation Reduction Act will continue. I think they're gone as they were set to end on December 31st.
Right.
What's happening with these massive increases due to the expiration of those enhanced subsidies, because again, it takes 60 votes to continue those enhanced subsidies under Biden's Inflation Reduction Act. That's not going to happen, right? So what's happening, and the reason we didn't have such massive attrition from the marketplace, is people just move from the benchmark plan, which was the silver plan, because of silver loading, down to the bronze plan. Or they bought a gold plan for half the price of a silver plan, right? So there's been movement in the marketplace, but there has not been attrition from the marketplace. Or if there has been, it's much lower than what, of course, the doomsayer said it would be.
Right. I mean, an example of this. These Soviet schemes are hard to make sense of, as you're describing with the gold and silver confusion. But the journal wrote, one reason forecasts may have missed the mark is that they overlooked that most enrollees still won't have to pay all that much for their plans. The Paragon Health Institute estimates that an average enrollee making 150% of poverty line, which is a little under 24 grand, will be expected to only pay $14 a week. An enrollee making 250% of poverty line, which is about 40 grand, would have to pay more, but still only $52 a week. and then of course income thresholds determine the subsidy amounts, which decline as incomes increase, but they don't include other government benefits like food stamps, welfare, disability payments, child tax credit. So it's in terms of where the mass of Americans are on the income household income distribution, it's just not going to be a significant increase for most Americans.
It is there. It is a significant increase for across the board because of the expiration of Biden's enhanced subsidies. Everybody's paying significantly more, but the shift to the bronze plans is tremendous because of the fact of silver loading. People can't afford silver plans anymore. People can't afford gold plans anymore. So there's a lot of shifting down to bronze plans, which are the cheapest plans. But the cheapest plans include an $8,600 deductible. So that's what's really going on.
So you're just looking at so the journal's just looking at the premium side, but the utilization side is where you're going to get hit because, of course, you're describing the deductible is going to be that much higher.
That's exactly right. And again, the journal is looking at the Paragon Institute, which is looking at the lowest level of income, just above 138% of the federal poverty level. For the rest of us who are not anywhere near there, we're over 400% of the federal poverty level, which is about $62,000 a year in 2026. We're going to pay full price for everything. And that is the major problem. That's why costs have gone up across the board. People who are not subsidy eligible are paying dramatically more in 2026 than they did in 2025.
And no, I mean that's a really important point, particularly when you're talking about middle income people, which is what you're talking about there. So, do you think this has been fully realized that I may not be feeling the pinch on the premium side, but boy, am I going to feel it when I have to utilize my plan?
Oh, they're getting it on both ends, Dan. Their premium has gone up substantially, and their out-of-pocket costs have gone up substantially, especially those moving from the silver plans down to the bronze plan.
And so what are we talking about for that person that's, middle income in the 65 grand range?
Oh, my God. I will tell you this. I've seen doubling of premiums. I've seen tripling of premiums in the case of silver level plans. In bronze plans, I've seen close to double, right? This, again, is for people who aren't subsidy eligible. People who are subsidy eligible are still getting very large advanced premium tax credits because, again, that part of the law has not changed. People under 400% of the federal poverty level are still getting tremendous reductions in premium. It's everybody else who is paying through the nose right now.
I'm just surprised there isn't more of a hue and cry based on what you're describing. I mean, I suppose it's just the people in the middle I was talking about earlier in the show that just are always play by the rules and are always getting squeezed from both sides, and they're sort of the silent majority that nobody cares about and nobody covers, and so you don't hear from them except perhaps on Election Day.
I hear from them every single day, Dan, every single day, and it isn't pretty.
Huh. Okay. That's really important because that's going to be maybe an issue that's below the fold because it's not getting coverage and the level of detail that you're providing here. But that seems to be a much bigger issue than has been reported on to this point. That's fair?
That's exactly fair, yes. And the other problem, of course, is this new website, getcovered.illinois.gov, which now all Illinois residents must use. They cannot use the site we paid $1 billion to make work perfectly, and that is healthcare.gov. We must now use this site, the state site. And that state site is not transferring payments to the insurance company that were made via that site for January 1st effective date. So I have multiple clients who paid their premiums in November and December, expecting their coverage to begin on January 1st, and today they have no coverage, Dan. None.
So just Illinois being the unique case is always uniquely bad. So what could and should be done at the state level to improve the situation, both in terms of functionality, what you're describing, as well as cost? Is there anything?
Yeah, let Illinois taxpayers once again use the federal website that we paid $1 billion to perfect over 15 years. That site works perfectly. It has worked perfectly for 14 of the last 15 years. But via legislation, we can no longer utilize that site. This is the first time in 15 years, Dan, where I have people who paid their premiums, did the right thing, played by the rules, and they have no health insurance as of today. And all they can do is create a ticket at getcovered.illinois.gov, which is behind hundreds of other tickets for other people waiting for coverage that they duly paid for and played by the rules and still don't have health insurance on the 16th of January. And many of them need that coverage and they don't have it.
That is wild. I mean, that is wild. C.S. Tucker, this is why we lean on you, knows everything that's going on. Unbelievable insight and value add. C.S. Tucker, HealthInsuranceMentors.com. If you're having problems, as you've just heard, he's the guy to go to. HealthInsuranceMentors.com. C.S. Tucker, thank you as always. Great stuff. Depressing stuff, but great stuff.
Indeed.
Dan Proft, Chicago's Morning Answer.
The more you listen, the more you'll know. This is Chicago's Morning Answer. Morning Answer on AM 560. The Answer. Hear sound teaching from God's Word.